So we'll start this series by talking about what you need to know in regards to the physiology and the steps of primary hemostasis. So primary hemostasis is the formation of a platelet plug that rapidly stops initial bleeding temporarily until secondary hemostasis has time to form a more secure clot. Okay, so we'll start with a quick recap on the structure of a blood vessel. Now I'm drawing this rather than using a fancy picture so that you can recall it and reproduce it from memory. So starting from the lumen out, we have the endothelial cells sitting on the basement membrane, and immediately after that we have a thick smooth muscle layer. Then we have the outer or external layer. Now these three layers are known as the tunica intima, tunica media, and tunica externa or adventitia, so from the in all the way towards the out of the blood vessel structure. So just to quickly recap and discuss the function of the basement membrane, as this is quite important to understand. So these are in threefold. The first is the expression of thrombomodulin and heparan sulfate, and this is quite important and will make a little more sense later in the hematology series. The second is the synthesis of prostacyclin, PGI2, and nitric oxide, both of which are vasodilators and inhibit platelet aggregation in normal circumstances. And the third is the production of plasminogen factor, and this will make more sense to you once we discuss secondary hemostasis. So just to quickly list out the vasodilators and vasoconstrictors which are important to know. This list is not extensive. There are many more. I've listed a reference if you're interested in reading more about that. However, this is not essential. So the vasodilators are PGI2 and nitric oxide. So if you recall, PGI2 is also known as prostacyclin. And these are both endogenous factors that cause vasodilation as well as inhibit platelet aggregation. The vasoconstrictors are nerve reflex as well as endothelin, which is produced by the endothelial cells. So before we move on and discuss the steps of primary hemostasis, let us first discuss von Willebrand factor. This is very important because firstly, it is essential in primary hemostasis, and secondly, there are many pathologies that involve von Willebrand factor, as we shall later see. So where is von Willebrand factor made? Well, it's made from two locations. First, the platelet alpha granules, and secondly, the endothelial Weibel-Palade bodies. The function of von Willebrand factor is what's very important here. Its function is to facilitate platelet adhesion. So this is where platelets stick to the damaged area of the blood vessel lumen. This in turn facilitates platelet aggregation, so where platelets clump together and stick. Von Willebrand factor is also a carrier for factor VIII, which we shall discuss in secondary hemostasis. So there are 5 simple steps of primary hemostasis, and these are very logical to understand. So let's go through them. The first is where injury has occurred to the vessel, and this can be due to a number of causes and reasons. As soon as injury has occurred, the vessel constricts. So as we can see here, we have a blood vessel and a site of injury. Blood is still flowing at normal pace. Now this vessel, because of the injury, constricts to decrease the blood flowing through this lumen and thus decrease any associated blood loss and allow platelets to adhere. So vasoconstriction is achieved by neural stimulation and endothelin. The next step is platelet adhesion. This is why I mentioned the importance of von Willebrand factor. After endothelial injury, von Willebrand factor is released. This binds to the exposed subendothelial collagen and also allows platelets to bind to the von Willebrand factor via the platelet GP1B receptors. To help you visualize this, here we have a blood vessel, site of injury. The von Willebrand factor binds here and thus facilitates the binding of the platelets via their GP1B receptors. This is platelet adhesion. Step 4 is platelet activation and degranulation. So, as soon as platelets bind, they undergo shape change from disc shape to sphere shape. This is platelet activation. Once they are activated, they degranulate, which is a fancy way of saying they release their contents. They release numerous things, including ADP, serotonin, fibrinogen, more von Willebrand factor, and fibronectin. The important factors to know are ADP and thromboxane A2. ADP promotes exposure of another receptor on platelets called GP2B3A, which is important for the next step. Thromboxane A2 is also important for the next step. Importantly, thromboxane A2 is derived from platelet cyclooxygenase. This is important to remember once we discuss the pharmacology of blood-thinning drugs. Just keep in the back of your mind that calcium is also released, which is an important factor in secondary haemostasis, which we shall discuss later on. Don't forget, other factors are also released, and there are many of these which you can check out in your own time. And finally, we get to step 5, platelet aggregation. So remember, ADP increases the expression of GP2B3A on platelets. In platelet aggregation, platelets clump together at the site of injury, and this is achieved via GP2B3A, whereby different platelets join together through fibrinogen, also known as factor 1. So let's pretend here we have two platelets, both of which have GP2B3A receptors, and these two receptors are linked together via fibrinogen. So you can imagine this occurring many times, and platelets begin to stick together. This is the platelet plug, and this is primary hemostasis. So, have we secured the injury? Well, the answer is no. The platelet plug of primary hemostasis is a temporary measure, and more importantly, it is unstable. Secondary hemostasis kicks in to secure this plug and make it stronger and permanent. Primary and secondary hemostasis could be occurring simultaneously, but we shall discuss secondary hemostasis in another series. Next up, we shall talk about the important pathologies of primary hemostasis.